Onyame Ishira Empagana so Nyuma Ajawa Jakuma Ghana Na Unshom Titangangana
The midwife and the nurses and mothers of hope who are actually doing this work. So they go in there every morning, talk to the pregnant women about themselves and the HIV positive state and how to live a positive life with your HIV infection and the need for you to take your medication and even the need to accept your results, because HIV management start with acceptance.
They normally get it from when they are in labor, when they are pregnant, they may get it. And when they are going to deliver too, they may get it. When they are after delivery and they are breastfeeding the baby too, they may get it. But during the pregnancy in all is 40%. From pregnancy, labor, delivery, and then when they are breastfeeding, in all is 40%.
But for my small facility here, I don't have HIV positive babies being born to us. If you see a positive child in this clinic, it means the child is being brought from a peripheral facility. Because here we do focus antenatal and our PMTCT is on course.
It's a policy now, the whole Ghana, that every pregnant woman that will come to your clinic, you have to test them. So we are testing all the pregnant women with HIV kits to see if they are positive or negative. And at the same time, we have been giving them health education, the way not to get the disease, the virus, to prevent them from getting the virus. And if any of them is positive, we put that patient or pregnant woman to we start treatment for that pregnant woman to prevent her baby from getting the virus, and she will also be the first 6 weeks after delivery, the baby will be tested after taking the prophylaxis of the antiretroviral drug. That's the prophylaxis for the baby. We'll test the baby with the DNA PCR test to see if the baby is negative or positive. After the test of 6 weeks, we encourage the mother to continue breastfeeding, and we also give the prophylaxis, that's cetrin suspension, to the baby. Then we'll repeat the test again after the cessation of the breast milk, that's 1 year. We'll repeat the test 1 year, 6 weeks. Also, we'll repeat the same DNA PCR test for the baby. The last one will be 1.5 years. If the baby is negative, the baby is negative, because now the baby is no more breastfeeding. And now you are going to use antibody test. It means the baby's antibody test that is working now. It's not, the baby is no more relying on the mother again.
Stigma is everywhere. The food you eat is being stigmatized. Your dress you are wearing is being stigmatized. So is the client himself. Self-stigma. When their self-esteem is down, they tend to stigmatize themselves. So what we do is we do trainings, and we work with strengthening catchment and community engagement of persons living with HIV. So we train mentor mothers who are HIV positive, has been on medication and have delivered negative babies. We train them as models of hope in the community and in the ANC clinics. So they help the new and upcoming HIV positive pregnant mothers to understand what PMTCT on both the part of the client and the healthcare provider. If the healthcare provider doesn't accept the client, that is where the stigma issues comes in. But if the healthcare provider accepts the client in her state, empathizes with her, client accepts also her results, where would the stigma lie? Then you will be lucky to get somebody who said, "Hi, I've been positive for 12 years. I have 3 children. They are HIV negative since I tested positive. I've been on medication, I've never missed a dose, so you can do it. It's an encouragement. Stigma will be reduced. But if the person is not aware of a state, doesn't have any coaching anywhere, what do you think will happen? Am I dying with my states? Because when HIV first reared its head, the news we heard was, this is a condition that will kill. But HIV doesn't kill. I have not seen anybody died of HIV. The people I've had encounter with, we have been able to reduce stigma. I am a national trainer of trainer in HIV, PMTCT, and a prescriber.
Bless our homeland, God, and make our nation great and strong, bold to defend for